Hello, my name is George Kovalevsky, and I am from the Delaware Institute for Reproductive Medicine. This evening, my goal is to speak with you about embryo grading and just explain that topic a little bit. So let's start with embryo grading. Embryo grading is a part of the IVF process. Once the eggs are retrieved from the ovaries and combined with the sperm, they fertilize, and we watch those resulting embryos growing and dividing in the laboratory. There are usually 2 points at which embryos can be graded: on day 3 after the retrieval and on day 5. Day 3 grading is much more descriptive and not as helpful in terms of predicting the chances of success with a given embryo. So mostly, when you're looking at embryo grades these days, we're talking about blastocyst grading on days 5, 6, 7 after retrieval. There are usually 3 characters that are involved in the grade. The first is a number that tells us about the stage of the embryo development, how far progressed the embryo is in its development. And then there are 2 letters, one referring to the appearance of the inner cell mass. Those are the cells in the center of the blastocyst that are destined to become the baby. And then the cells making the wall of the embryo are the trophectoderm, and that's the second letter. So 3 different things, 3 different grades that we're really looking at to make up the full grade: the number telling us the stage of development, and then the 2 letters describing the inner cell mass and the wall, the trophectoderm. The grade is a rough guide to the chances of success. It is by no means definitive. So even the most gorgeous, beautiful looking blastocyst that gets the AA fully expanded still may not be a normal embryo and may not succeed. On the other hand, an ugly duckling embryo can still make a completely beautiful, normal, healthy baby. So only a rough guide. The better looking the embryo is, the better the chance that it will be normal and will be successful. Okay. So the grading is mostly used to help us choose, if we have more than one embryo, which one we will start with, which one we will use. So usually we use the embryos that have higher grades to start with, knowing that they have better chances of success. So I think that's my overall take of the grade of the embryos, and I always urge patients not to get too hung up on it, as it is not definitive in predicting success. Now, related parameter to choosing embryos is the preimplantation genetic testing for aneuploidy, PGTA. And that is a much better predictor for success. So if an embryo is tested and found to be chromosomally normal, then we know that that embryo will have a really good chance of success regardless of the appearance and its grade.